Patients who are sponsored by managed care organizations may or may not be reimbursed for specific products, services, and procedures. To submit accurate health insurance claims and to help patients as much as possible, medical assistants should establish office procedures that comply with managed care requirement.
You look like you have a question, Ms. Thomas. How can I help you?
Yeah, it's this prescription I just got from my nurse practitioner. My insurance just changed and I don't know if they're going to cover this.
When a patient has questions about her insurance coverage, ask her for her health insurance ID card and the prescription or provider's order.
Sure, I can check that for you if you have a few minutes. I just need the prescription and your insurance card.
Okay, there you go. There's that.
Review the coverage information and phone numbers on the card.
Thank you so very much for checking on this for me. I really do appreciate it.
Sure, I'm happy to help.
Call the insurance company and clearly state the information they'll need to assist you. Verify the patient's information and explain her question.
Hello, this is Laura from Pedersen Medical Clinic. I'm calling for one of our patients, Candace Thomas. Her ID number is 345-71705. Group number is 455. Okay. Her date of birth is January 27th, 1989.
Demonstrate professionalism by presenting a respectful, clear, organized message.
Ms. Thomas is wondering if her Flonase inhaler is covered by her policy. It's for a 220 microgram dose.
Learn the correct pronunciations of medical terms, especially those used frequently in your office.
250. Is there any chance that it can be covered? I see. Are there any alternatives? Okay, I got it. Nasacort and Zyrtec. Thank you. I appreciate your help.
$250? That's crazy. Where am I supposed to get that kind of money?
Explain the insurance representative's response using language the patient can understand.
I completely understand, Ms. Thomas, and you overheard correctly. The Flonase inhaler is not covered by your insurance and will cost about $250 if you pay out of pocket.
$250? That's not an option. It's robbery, and I really need this medication to live.
Demonstrate sensitivity by paying attention to the patient's nonverbal behavior and verbal message.
I can empathize. This medication is vital to your health, and $250 is really steep.
You know, I don't understand. I have insurance, and this is still happening.
Show empathy and clarify that you understand her. Give the patient your full attention during the conversation and reserve judgment. Your tone of voice and body language should communicate respect. Use eye contact if it's culturally appropriate to do so. Stay calm. Keep your arms uncrossed and relaxed as you listen.
You know, isn't that what insurance is supposed to prevent?
It is, and you're right. There is some good news, though. When I asked her if there were any alternative medications, she gave us two options, Nasacort and Zyrtec. Before we do anything else, I'd like to ask your nurse practitioner if either of these options is appropriate for your care. If one of these options will work, then we'll get you a new prescription.
Offer alternative solutions if appropriate. Taking the time to check and verify the options is a good way to show that you care.
You know, if those two medications are the same, why didn't Nurse Burke just recommend them in the beginning?
That's a good question, and the simple truth is she might not have known that these were covered and this medication was not, or they might not be right for you.
You aren't just going to leave me stuck with this, are you?
Not if I can help it. Shall we go talk to your nurse practitioner about it?
Yes, please.